Welcome to our video. In this video, we will be discussing the Nigerian healthcare system. Before we begin, let us introduce ourselves. We are Janae Fair, Zohal Rafif, Brianna Molnar, Emil Tongongo, and Jennifer McGilvery. As an introduction to Nigerian healthcare, we would like to share a few facts about Nigeria. Nigeria is located in the western part of Africa, and it's the 32nd largest country in the world geographically. The Nigerian population is just over 186 million. By a landslide, Nigeria is the most populous country in the African continent and is the world's 7th most populated country. The government of Nigeria is a presidential federal republic. The current president is Muhammadu Buhari, who stepped into office in 2015. We chose the Nigerian healthcare system because of its low ranking of health system performance by the World Health Organization, which placed Nigeria at 187 out of 191 countries. There are over 250 ethnic groups in Nigeria. The three main ethnic groups are Hausa, Fulani, Yoruba, and Igbo. The most common languages are English, Hausa, Igbo, and Yoruba. There are over 500 indigenous languages. In this video, we will discuss the overview of the Nigerian healthcare system, the analysis of the healthcare system, and the health status of Nigeria. Also, stay tuned for an interview from key informants, Victoria and Muna. They'll be discussing their own personal experiences with the Nigerian healthcare system. First, we're going to talk about historical roots. Traditional healing and medical practices in Nigeria have included herbalists, divine healers, soothsayers, midwives, spiritualists, bone setters, mental health therapists, and surgeons. Pre-colonization healthcare included traditional healing and medicine. British influence increased over the 19th century, and Britain officially occupied Nigeria in 1885, thus affecting traditional ways of healthcare knowledge and delivery. Nigeria gained independence from the British government on October 1, 1960, thus marking a new era for Nigeria. Primary health care was introduced in 1988 as the new way to deliver healthcare to the Nigerian people. Influential factors on system development. Regardless of more than 150 years of Western influences on healthcare, traditional medical and healing practices remain a present and important part of Nigerian healthcare. And today, primary healthcare plays an important role in Nigerian healthcare, social, and economic welfare. Stakeholders in the healthcare system. The stakeholders include the state ministries of health, the state hospital management boards, and local governments. The federal, state, and local tiers of government provide health services and programs, and hold responsibility for health promotion. Nigeria has 1 federal territory, 36 states, and 774 local governments. The 1999 Constitution of the Federal Republic of Nigeria states that the 3 tiers of government, federal, state, and local, are to support, in coordination with one another, specific functions of the healthcare system. These specific functions include the following. The federal government is to provide tertiary healthcare, the state governments are to provide secondary healthcare, and the local governments are to provide primary healthcare. Mandate, mission, and vision. The mandate is for the provision of quality and services for the health of all Nigerians. The mission is to develop and implement policies for effective, efficient, accessible, and affordable health services with stakeholder partnerships. And finally, the vision is to have a world-class healthy country.
In this section of the video, we will be talking about the classification of the Nigerian healthcare system in regards to BOEM's classification, how the system is funded, regulation of the health system, and how services are delivered. BOEM's classification of taxonomy is a way to organize healthcare systems into 3 dimensions by regulation, financing, and service provision. Each of these 3 dimensions can be dominated by state, societal, or private actors, which make a total of 27 possible combinations that classify countries. The Nigerian healthcare system fits into the classification of a national health insurance plan, as Nigeria has a national health insurance scheme. This aims to improve access to healthcare and reducing the financial burden of out-of-pocket payment for healthcare services. Social health insurance is a system of financing healthcare through contributions to an insurance fund that operates as a pool of funds to cover the cost of healthcare and eliminates barriers to obtaining service at the time of need, especially for vulnerable groups. Now on to funding. In Nigeria, there is relatively low government spending on health. In 2014, the healthcare expenditure was 3.7% of the country's total GDP. Per capita spending is only $118. The federal, state, and local governments retain overall responsibility for funding health services at their respective level. Approximately 72% of healthcare is provided by private vendors, and only 26% by the government. Over half of the population in Nigeria lives below the poverty line, less than $1 a day. This leaves them unable to afford the high costs of healthcare. Various agencies at the federal and state levels fund programs across different levels through general taxation, direct payment, and donor agencies. Regulation in Nigeria. The national health system is decentralized into a 3-tiered structure, with responsibilities at the federal, state, and local government levels. All 3 tiers are involved in all major health system functions, including stewardship, financing, and service provision. The National Health Act of 2014 aims to establish a framework for regulation, development, and management of the national health system. It sets standards for rendering health services, as well as strives to achieve universal health coverage and meet millennial developmental goals. At a federal level, the Ministry of Health is responsible for policy and technical support to the overall health system, international relations of health matters, the National Health Management Information System, and the provision of health services through tertiary and teaching hospitals and national laboratories. At a state level, the state ministries of health are responsible for secondary hospitals and for the regulation and technical support for primary healthcare services. At a local government level, each local government is subdivided into 7 to 15 different wards, similar to health regions. Primary care is the responsibility of the local governments, where health services are organized through the wards. The community level provides an important link in the healthcare delivery. It forms a support structure for the implementation of primary healthcare services. There are many professional and regulatory bodies in Nigeria, such as the Medical Council of Nigeria, the Nursing and Midwifery Council, Pharmacist Council, Medical Laboratory Scientists, and the Community Health Practitioners Registration Board.
Now we are going to talk about service delivery into the 3 categories of care, mainly primary, secondary, and tertiary care. Primary care is managed by 774 local governments and private practitioners. Secondary care is managed by the Ministry of Health at a state level. Tertiary care is managed by the federal government, non-governmental organizations, and private practitioners. This is a small visual showing how many general hospitals, primary health care centers, teaching hospitals, and federal centers that are within the country. Services are provided by the general physicians, nurses, and specialists. They offer things like traditional medicine, surgical and emergent care, and elective procedures. They do have mental and dental health to some extent, but it's very scarce. If anything, only a few people actually use these services if they are being used at all. Preventative services are also offered, but this is a new concept to them as they move towards health promotion and disease prevention. Services are offered mostly in care centers and hospitals. Here is a breakdown showing the ratio between healthcare professionals and the population. In the community, rural areas have been neglected in terms of capital growth, financial interests, and social infrastructure. This leads to the shortage of healthcare workers and healthcare facilities within those areas. Out-of-pocket expenditure accounts for 95% of the care service payments. The NHIS only covers 0.8% of the total population, leaving millions of people without government insurance. 70% of the population is unable to afford these services. One thing to note is that unemployment rates are 13.3%, meaning that although a lot of people are working, they are not making enough to afford healthcare. Right now, the system focuses on meeting the acute care needs of the people. And because communicable diseases account for 72% of the deaths, preventative services do play an important role in this. The population is seen to be healthy if disease and death rates are considerably low, meaning that if communicable diseases are being controlled, this would greatly affect and positively affect their life expectancy.
One of the major setbacks of Nigeria's healthcare system that concerns me is a lack of adequate emergency response. Not every city has an ambulance or an emergency response team. I remember every time I needed an emergency service, my parents had to drive me to the hospital. Another issue with the emergency department is related to triage inequities. Triage is centered on the ability to pay for services rather than complexity of patients' conditions. Basically, some healthcare professionals could ignore a need for medical attention because the patient could not pay the required down payment.
Muna tells us from her personal experiences how mental illness is viewed in Nigeria. Muna explains how mental health disease is still an invisible disease in Nigeria, and that many individuals with mental illness are labeled as crazy. Muna states that generally a huge stigma with mental health diseases occurs in Nigeria, and when someone has a mental disease, they typically try to keep it to themselves. Muna tells us that mental health is often seen as a spiritual problem, so if people are willing to seek help for mental illness, they will often seek help from a traditional or native doctor. The information Victoria and Muna have shared with us is only the tip of the iceberg. We will discuss more of these challenges and barriers in the following section.
Now we are going to talk about the health status and concerns of the population. Life expectancy gives us a snapshot of overall well-being, and females live to up to 55.6 years, while males live to up to 53.4 years, compared to the world life expectancy average of 71 years. Looking at this trend between 1960 and 2014, we can see that there has been an increase in life expectancy, but it still remains below the world average. The top 5 diseases causing mortality include influenza and pneumonia, HIV and AIDS, stroke, coronary artery disease, and diarrheal disease causing dehydration and electrolyte imbalance, noting that a lot of these are preventable. Non-communicable diseases are steadily rising, notably hypertension, diabetes, neurological disorders, and road traffic injuries. Malnutrition is also very common in this country, affecting up to 2.5 million children. Maternal mortality rates are as high as 630 per 100,000 live births, while children under 5 years have rates as high as 124 per 1,000 live births. Now we are going to look into the barriers of providing service. There is low accessibility in rural areas and delayed access to healthcare, so they do not have a lot of infrastructure set in place. The biggest problem that they have are the high poverty rates. Up to 68% of the population live on less than $1.25 a day. As stated earlier in this video, there is high out-of-pocket spending with low government compensation. Now, keeping the poverty rates in mind, this leaves people, a lot of people, with poor health insurance or no insurance at all. Corruption is a huge issue in this country and is prevalent in every level of the health sector. This causes the loss and misuse of health resources, making health policy initiatives, provisions of care, and international aid less effective. Our biggest question is, are healthcare needs being met? The answer is partially. And although they do receive a large amount of foreign aid, for example, in 2012 the US donated $336 million, despite all of these efforts, not all of the healthcare needs are being met. For example, mental and dental services are not available due to shortage of personnel, and it's not surprising to see that there are a lack of specialists, making delivery of healthcare limited and unequitable. And so that is it. Thank you for watching. If you have any questions, just leave a comment on the thread below.